Morning, everyone. I'm Councillor Mike Quigley, Chair of the committee, and I would like to welcome you to all to this meeting of the Adult Social Care and Public Health Select Committee, which is being broadcast live and recorded for publication. Do we have any apologies for absence? Yes. Scott Colton.
Chairman, we have apologies from Councillor Sybil Fielding, who is unwell, and Councillor Jim Creamer is here substituting for her.
Thank you. Minutes of the last meeting have been duly circulated. Can I ask for a show of hands to approve that the minutes of the meeting are correct and that they be signed? All in favour? Clearly carried. Thank you. Are there any declarations of interest by members or officers? None. Thank you. I move on then to agenda item 4, which is the social care market pressures update. So we have a presentation from Kashif Ahmed and Melanie Williams, and then we will have the opportunity to ask questions and comments on the presentation.
So thank you very much, Councillor Quigley. So it's a new territory, I think, for all of us. This is the first of the committees of this kind that we've certainly been a part of, and we're pleased to be here today, and hope that we'll be able to answer any questions that you may have above and beyond those that I think we've already answered quite comprehensively on this subject. Obviously, it's quite a complex, and the ramifications of this subject have deep implications for the residents of Nottinghamshire, indeed for the residents of our entire country in regard to adult social care matters. And so we approach this committee with the seriousness, despite the fact we've been over this subject matter many times together before. Because of its seriousness, because of the implications it has on the wider populace, we're delighted to be here, and we hope that this committee can prove of worth in us working together to derive the best outcomes for our residents and for our communities. So a joy to be here, and I'm pleased that Cash is going to open up and lead us on the presentation. Melanie, do you want to say something?
Go on to the next slide, Gemma. Good morning, Councillor Quigley and Councillor Martin and committee. So we're going to be focusing on 3 things through the session of scrutiny. The first is how well we're doing in implementing the decision in the July Cabinet to invest in the adult social care market to increase sustainability and capacity by increasing rates in a targeted way for certain sectors of the market. So Cash and possibly Gemma are going to comment on how well we're doing implementing the action plan. We're also going to talk about the cost of care exercise. So this is part of adult social care reform. It's part of the set of 9 reforms that government have announced last year to be reforming the adult social care delivery. So we're going to be describing the requirements being placed on us by the Department of Health, the timescale to which we're working, and to set out the way we're going to be handling that part of the reform. And then lastly, we're going to provide more of a, I suppose, a discussion item on how we're investing in the adult social care workforce. So this will touch on our own internal workforce, because that was what committee asked us to do, but with quite an emphasis on how we're working with our providers and trying to support and develop the 24,000 people that work in adult social care in the county. So we're going to be describing that for you. So I'm going to hand over to Cash, who's going to start with describing what was agreed by Cabinet in July and how well we're working to deliver those recommendations that Cabinet accepted.
Thank you, Mel. Good morning, everybody. I will talk through a brief presentation on the key parts of the report that we've presented here. In terms of adult social care pressures, we've talked quite extensively at the Cabinet meeting in July around the key challenges. And again, no surprise, in terms of key challenges, recruitment retention is a significant challenge within the care sector and many other sectors as well, due to the wider challenges in the economy. However, the recruitment retention has been significantly compromised over the past during COVID, and then also we've had significant challenges within the provider sector early in the new year when we went into situations where providers were no longer able to provide care and support, and therefore they were, in essence, handing back packages of care. And that was, again, a really challenging circumstances. And again, we have procedures in place to support providers in that situation. So Gemma, as our group manager for quality market management, and the team were able to, during last winter, were able to step up and support providers in that situation. And we were able to ensure that the people with the greatest need were able to access care and support needs at that time. Pleased to say that more recent weeks and months, things have stabilised a little bit, where we have providers that are showing resilience, are able to continue with their contract obligations and able to continue to support people. However, it can be quite unpredictable. So we are heading towards winter, and again, we're expecting there will be further challenges around workforce and capacity. So recruitment retention, one of the key points to highlight again, and we highlighted in the report, was what we haven't seen is real growth in terms of or increase capacity. So providers have continued to struggle to recruit, and also what providers also, care providers also report consistently is that they do tend to lose staff to other sectors. And again, that's been a consistent feature. And this is not just isolated to Nottinghamshire, it is right across the country. Most local authorities and health and care systems are facing this challenge within the care sector. Also to briefly touch upon increased demand. Despite the difficult circumstances that the market has been operating, I think it's still quite remarkable how we've continued to provide more care and support year on year. And that's remarkable in the circumstances that the providers and the care sector actually operate. However, the challenge and the pinch point actually is that the growth or the capacity increase isn't increasing at the rate of the demand that's required within Nottinghamshire. And that's a challenge. And that's because we have more people that have complex needs. We have more people accessing elective or going through hospital pathway services and inpatient services that then, following hospital admission, require care and support ongoing. So the actual overall demand is significantly increased, and that's the challenge where we need to see. We're trying to support the providers to increase that capacity so we can support more and more people in Nottinghamshire. And that's the challenge. And again, I will briefly touch upon that's where the rationale of increasing the £1 increase uplift. Again, one of the rationale and one of the ambitions and intention is to see A, to stabilise the market, but B, also we want to see that growth in capacity in order to meet the needs of our residents. In terms of key challenges, what we've also highlighted in July was that we had a number of providers struggling, not just around recruitment and retention, but also around financial viability. And that often could be linked to recruitment retention, but also it can also be linked to that the business model perhaps isn't working, or the operating model isn't working. So there's lots of range of factors around financial viability. Some of the providers have struggled, and so we've had that. That's been a consistent feature over the past year. Things have stabilised a little bit. However, we continue to have oversight around some of those providers who may struggle in the future. In terms of what that means, those challenges actually means there's an impact where we have provider failure, and we've had provider failure, and we have our emergency and contingency planning process, and we supported providers during that difficult time. We also have quality and contractual concerns as a result of that. And again, Gem and Quality Market Management team will work proactively with providers where we have got concerns around quality, and support those providers to improve on quality aspects of their service, and that's been an impact within the market around that. What this also means is that often, due to those challenges, often there can be providers. Again, it means that our residents sometimes will actually have a poor experience of using those services, and also around poorer outcomes. Again, what I would say is, by and large, the care market, we have more than 400 care and support providers in Nottinghamshire that actually are contracted, and by and large, the vast majority do perform really well, present really good outcomes. But the ones where we do identify quality concerns, we work proactively around that. And then also financial impact for health and social care. Due to the lack of capacity within the market, it means what we do have is then we have a challenge across all of the health and care pathways. So often use the term bottleneck. So we have people who are in the wrong care setting or in the wrong pathway because there isn't enough capacity or flow into those services, and that's been again a consistent challenge, ongoing challenge that we have been going through. Having said that, more recently, the ICB Health Integrated Care Board have invested in further investment around discharge and discharge to assess capacity. And again, we are a key partner in that process. And so we've been successful in securing some further capacity around that. However, we need to continue to work with our partners around how can we create more flow going forward. And finally, on this particular slide, I'll just briefly touch upon is that the fee increase of £1 in relation to home care and also care and support enablement services, which are supported living and support accommodation and outreach services. And again, that was approved by Cabinet back in July, and we'll talk briefly through how the team are implementing that decision. Okay, so next slide. So again, as I mentioned, in terms of fee uplift, been applied to home care and also around care and support enablement providers from the 12th of September. So that process has been, in terms of implementing that, has recently commenced. And again, just to briefly touch upon this, I know it was highlighted the risks in home care and in our care and support enablement services. Those were the highest risk in the care market. So we've had to prioritise those two sectors in relation to this. That doesn't mean that we're not working with other sectors like care homes, nursing homes. There's a lot of work we still are supporting those providers and those sectors, but we've had to really look at where the greatest risk is in terms of adult social care, and hence why a decision was taken back in July. We continue to engage with providers to ensure that uplift results in pay increases. And again, although we don't have contractually or legally, we can't enforce providers to pass on the whole pound. We have seen some examples in recent weeks where providers have, written to us or emailed and confirmed actually that that's what they intend to do, which we welcome, which we, absolutely, we think that's the best thing, the right thing to do. Equally, prior to this decision, the engagement that we've had, by and large, most providers are challenged around recruitment, are challenged around workforce, and therefore they've given a strong indication that if any rates uplifts were given, we would actually pass those on to providers. And again, what we will do is, and I will talk through a little bit in my next slide, is about we will look to measure the impact and actually measure how much of that is being passed on to providers. So yes, on one level, it's great to see there's a real appetite from providers. There's a real commitment from providers to pass that on, but we will want to measure that on an ongoing basis. And that's my third point there as well. So overall, in terms of the fee uplift, those were the key highlights in terms of going forward. There are also, this is not just about increasing pay rates and it's not just all about investment. It's also about how can we support the market in other areas. So one of the other aspect of support to to the provider care market was around workforce fund, and the local workforce funds established, which again it's £500,000 to flexibly support local care providers, and that's to support them around sustainability. So during the summer, we knew that increased energy cost, fuel cost, and also cost of other operating costs that we felt at the time providers were indicating that they are feel compromised and challenged. And so as a result of that, we've established a provider sustainability fund where providers can actually apply and access that fund. And that's been in place since the summer. And again, and we have providers accessing that on an ongoing basis. Thirdly, market shaping team. This is where we are in the process of recruiting a team to commence in October to develop our market shaping framework and programs of work. And again, in terms of the market shaping, the key aspect to this is about how do we develop a relationship and a partnership that's based on collaboration with the care market, and how can we ensure that we are able to develop more innovative, different ways of working, different models of care, and how can we, for example, how can we adopt and scale up technology and digital within the care sector? It is still quite a traditional care sector, and so there are other ways of new models of care that can actually mean that there are good outcomes for our residents, more efficient way of working, and also enables staff to be more creative, also enables our workforce to see a future, a career pathway within the care sector. So I will briefly touch upon that in my further slides. Just next slide. Okay, so in terms of the fee uplift, I've mentioned earlier feedback from providers is, and again, we are actively engaging with providers. How do we measure this? And so we are looking at regarding workforce fund and fee uplift is the impact on pay levels, numbers recruiters, numbers retained. So we will be evaluating from the 12th of September. We're establishing a baseline with our care providers to ensure that we are able to measure the impact around recruitment retention. And I think that's and again, providers are actively engaged with that process. Equally, in terms of increasing capacity in home care, measures include number of hours providers, reductions in the in the home care gap, and reductions in handback. So there are a number of measures that we will put in place around home care as well. And we have really good data now, a dashboard where we can actually see some of that information. And again, we will be looking at ensuring that measuring the impact of the increased rates and also the workforce fund. Coming on to the care and support enablement services, these are our supported living services. And again, we want to see an increased capacity and also more developments within the county. We have a real comprehensive programme of work, a pipeline around how we want to create more supported living services. So these services are alternatives to residential care. It's for people accessing more community-based services in their local communities. And again, we will be looking to measure that as well. And the fourth and final is also about measuring and we'll want to see as part of this work is a reduction in safeguarding and quality concerns. And this is an approach that we will be planning to implement in relation to this work going forward. Just next slide, Tom. So in terms of the market shaping, again, there's quite a bit. It's quite a busy slide here. What I will explain in terms of market shaping. So as a council, we have a function around market oversight. So and again, our quality market management team have, they will look at that oversight of quality of our care providers and ensure that have that oversight, but also have arrangements in place to support providers. But what we also want to do is not just look at how we have oversight. We want to actually develop a new set of relationship, which is more collaborative, more creative, more innovative, and that's the approach we want to take. And it's more around having a more shared approach to going forward with some of our challenges. So just some examples I will share here is in terms of market shaping, we want to ensure the market is aware of what's the needs of our population, what's the needs, and what's our what do we want. Sorry, apologies. So in terms of the commissioning market, what we want to do is through our market position statement is to share more details around the needs of our population and the types of support our residents require over the next 5 to 10 years. So if we can give those key messages and information, the market will be able to then adapt to new models, new services, and we want to see that we want to see that shift over the next few years. We also want to see how we can shape and develop a market that is able to embrace and adopt technology where it's appropriate, where it's appropriate to do so. And again, many providers have approached us that they are wanting to develop technology as part of the offer. And again, we will be wanting to scale that up over the coming weeks and months. And that will enable as a whole, as a sector, as a system, to be more efficient with the existing provision and the existing hours, because we know that there are people who could be supported in a different way and through technology solutions. And there are many examples, many councils and other authorities have actually done this for a number of years. And then equally, what we also want to see is that the care sector, we want much more greater collaboration around recruitment, around training, around workforce. At the moment, what we have is providers will have their own arrangements, and I think that again isn't. We want to see how they can collaborate and be more efficient and more effective by collaborating either on a place-based partnership. So rather than having each organisation doing their own recruitment workforce, there's a scope to actually do more of that collaboration. And then finally, just on the market shaping, is that when a provider is compromised, when a provider is struggling with capacity, often they will seek support from the council and through our quality market management team. What we want to do here is say, actually, what we want to do is through a collaborative of providers, if they work collectively together, they can support one another and actually share some of their capacity, especially if they're under pressure. So again, there's quite a lot of that work we want to progress with the market in the future. So that will be a significant programme of work with our that will be delivered through our market shaping team that we're in the process of recruitment. Next slide. Okay, so Melanie briefly touched upon the cost of care exercise, which is part of the social care reform, and it's a requirement for all councils to undertake. We're actually in the process, right in the middle of the process of actually working through that process, and again, this is to require undertaking the cost of care exercise for home care and older people's care home to determine a local cost of care, and it's about really understanding the cost of care or the cost of care between council rates and self-funders rates, and it's in essence about in relation to equalising the rates between the two. So there is quite a detailed process that we're going through at the moment, where we're seeking that information, some of that detailed information from our providers around their cost, and that again, all of that information will be then submitted to the Department of Health, and again, that will be a draft submission on the 14th of October, with a view that we will also be looking to final submissions will be in the new year in February, and again, that process obviously we have information that there's some funding that's been put aside by central government in relation to this exercise. However, what we did report previously in July cabinet report that it's likely that it won't be enough. So there is a potential risk to councils in relation to the local cost of care exercise, and we've highlighted that risk to Cabinet in the summer. However, we are still engaged in that process, and we are on track to make that submission to Department of Health on the 14th of October. Okay. I think that's the. Okay, I think this is my probably final and last slide. So just to summarise, and also highlight some of the other work as a council we're doing around recruitment and workforce. Mentioned around the workforce grant, which is a provider sustainability funding that is available for providers. What we've also done, and I think just mindful, I'm just thinking whether Gemma, would you like to come in? Because I think these the next few slides, Gemma and the team have been heavily involved in this process. So I want to briefly just cover the workforce initiatives.
Yeah, no problem. Thanks, Cash. Yeah, just in terms of recruitment and retention, we set out early on this year, as set out on the slide, a few things we were going to sort of do with the market and support the market. So obviously, Cash has talked about the grant, but we've also got the local recruitment campaign and fairs. So at the beginning of this year, we did a big campaign using local radios, use of social media, and use of bus stops. And the signs, actually, we saw some success with recruitment then. There wasn't what we expected, but obviously it was a bit of an unknown for us because it's something we've not had to do in the past. And obviously it's something we've learnt on and we'll actually build on over the next coming years and ongoing with our providers. And also what we've done on the back of what our social care providers have said locally is actually like a local social care only campaign, because there's lots of fairs that happen, like recruitment fairs, but they're all for all sort of sectors, and they actually wanted a specific recruitment fair. So we've trialled that out in two areas, one in Retford a few weeks ago and one today in Mansfield at the Stags grounds. So hopefully we'll see some sort of impacts from that, and if not, some lessons learned about how we can do things differently in the future. And again, that is with our providers. Our providers have supported that, and it's all actually collaboration with our providers. It's not been led by us in terms of setting those up and getting the venues, etc. It's what they've chosen. I've talked about them in the past. We meet very regularly with our home care homes and our care support enabled providers with forums. And again, they continue. We are starting to do more in-person events, because actually what the providers asking, the virtual events are great, easy to access, but they don't get that, and we don't get the feedback we'd like from the in-person events. So we are trying to do more of those as and when necessary, but we do meet regularly with our social care providers. We've got a home care board, and we obviously, Cash has talked about all the plans and implementation of all the work we're doing in terms of market shaping, and they will continue, and they'll be key in terms of taking a lot of our sort of strategies forward and sort of the work we've got planned over the next year to 18 months. I've talked about provider collaboration, and Cash mentioned about helping us in terms of aligning training, recruitment and allocation of packages of care. So again, it all fits into the home care board and all aligned, but actually hopefully in the future, a lot of this can be led by our providers with our support rather than us doing it for the providers. So that's something we've got to work with providers, but they're all, as Cash said, they're all under a lot of pressure, all very busy. So I'm mindful that things we've got to take our time and work closely with our providers in a timely manner. And obviously we talked about fee uplifts in terms of that £1 an hour, and obviously the ongoing work with the cost of care. So yeah, so there's quite a few things happening in terms of the external workforce and supporting recruitment and retention, but also other things in terms of strategic, in terms of the boards and working with our providers and making sure their voice is heard in terms of taking a lot of this work forward. Thank you.
So if I can just summarise for you, Chair. So in essence, we have a whole range of activity going right across the department. Some of it we would describe as fairly typical and business as usual, which is the last slide about how we're supporting recruitment and retention in our role as market shaping and market oversight within the Care Act duties and responsibilities. And then we have the additional work where we're supported by Cabinet to implement some additional measures for the market to support our post-COVID recovery and to respond to some of the economic conditions. So Right, the chair, over to you. Thank you.
Thank you. I'll now open it up to questions and comments. Councillor Adair.
There's a lot of activity going on there, and a lot of work going on. What would be your measurement of success on that journey so far?
In terms of measurements of success, we have seen an adult social care market that has been struggling and deteriorating through the first part of this year. So our immediate measure of success was about trying to stop that decline, the deterioration, and stabilise the market. So the main part of the summer has been focused on that stabilisation and preventing further deterioration. So one of the successes we've had is that we have seen far less provider failure in the home care market since we've implemented some of those measures. So we have seen that our providers are more sustainable in terms of continuing to provide care for people. So I suppose the colloquial language would be about handbacks, but in, I suppose, sort of plain English, that's about when a provider is unable to provide care, so over a weekend or the week, we're saying their business is collapsing. So we've seen that as a measure of success. Going forward, we want to see some growth in those providers. So the first step was about stabilising the market. The next step is about seeing the growth in the retention, the recruitment. And then the third measure of success would be about the diversification that Cash mentioned. So how we're enabling technology-enabled care, assistive technology, and a broader range of providers to be operating in adult social care. That will be our final measure of success into next year.
Yes, thank you, Chairman. Actually, it was partly answered in the question to Councillor Adair's question. However, as you say, you're going through a period now of stabilisation, etc., but we see that there's going to be growth in the market for years to come, etc. So what are you doing to inform and attract new entrants to markets in Nottinghamshire and in the wider area?
So in relation to supporting new entrants into the care market, we talked through quite a number of those recruitment initiatives that are ongoing. However, we're also talking to the care market around establishing a Nottinghamshire Care Association or similar forum or similar type of arrangement which exists in other counties or other areas. And so the purpose and reason for that is that what we want to do is develop a partnership with the care sector around some of those complex long-term challenges that we've got. And what we need is a representative body in the Care Association to have that kind of two-way conversation, a partnership where we can co-design and actually have care sector fully represented right across health and care. And that's a gap at the moment. So we are working with we have a partner that's we're looking to commission that will support actually having engagement at the moment as we speak. And a number of the care businesses or care providers and leaders in that care sector are really keen to develop that. And what our role is not to dictate what that might look like. Our role is to enable, support those conversations, and that's what we're looking to do. And we're hopeful that through that process we can have a much more strategic approach to some of these issues.
Just to add to that, so the outcome of that, Councillor Carey, would be that we'd hope with that infrastructure that's in place for the market, that would encourage new entrants to develop and grow, because the feedback that we're having from providers is it's a difficult environment to set up a new business. The other piece of action we've taken within the council is a much closer relationship with economic development. So we're linking up now a specific intervention for social care markets in the business hub, the growth hub, that economic development colleagues run in the council. So they're shaping up a specific offer for adult social care to recognise the challenges. So therefore those businesses will get support to the usual things that any other business small business in Nottinghamshire would get, but it'd be more bespoke to their needs.
Can I just come back on that? I mean, obviously, in near my patch, there's a new care home being built, quite a significant one, and obviously, the way that all the local authorities, local plans, economic development and housing, all that kind of stuff, that there will be future needs in different areas according to population, economic growth, all that. So, how do you influence is that how you're going to influence the care market to be in the right place for the future residents?
Thanks, Chair. In relation to the Cabinet report, which is before us, and we as a scrutiny committee are obviously supposed to be scrutinising, I sometimes think that it might be a touch early because some of the things that the Cabinet have implemented aren't necessarily up and running, and we haven't got the information whether or not they're working. So I think as time goes on, we'll be able to scrutinise Cabinet's decisions more thoroughly as information and things come in. In relation to the report, though, and it's been touched on in relation to page 18, paragraph 8, which touches on our concerns in relation to one, it being a difficult time to set up a new care home, but obviously the report states that there may be an increased rate of provider failure. So if that is the case, I want to be assured that Cabinet have a number of measures in place to address that problem if it arises. And I mean, at the end of the day, if a provider actually fails, then we as a county council presumably will have to pick up the consequences. So I think Cabinet needs to address that problem or indicate to us as a scrutiny committee that that is the case, that provision is made for that eventuality. I mean, when you look at the issue of sustainability and growth, and paragraph 9, it states that there are people that there may be a further increase of people not receiving the right care in the wrong setting. So obviously that would cause us as a scrutiny committee concerns, bearing in mind how many people are in the wrong setting and receiving the wrong care. I mean, it needs to be really looked at. Can I just get confirmation of the case then? What happens in that situation? And do we have statistics about the number of people that are in the wrong place and receiving the wrong care? And is there an expectation that that problem may well increase? So I'm just asking questions in relation to the Cabinet's reports. I have other issues that I may bring up, Chair, but if I could answer those, I'd appreciate it. Thank you very much.
Thank you, Councillor Henshaw. I just thought I'd chip in quickly on this one because I drew just to hopefully bring a little bit of encouragement. The first week that I was in this post, I received an email to notify me of some challenges in a care home. And I read it and it was very sobering. And I actually went into slight panic mode, which resulted in a series of phone calls. And I was quite reassured very rapidly to discover that there is a safety net that exists within the governance structure of Notts County Council for exactly that situation where care homes are either failing or heading in a direction which their quality of care isn't up to par, or ultimately fail because their financial model doesn't stack up. Where care providers are in a situation where they're not providing the quality of care, and that we can become aware of that through a variety of different windows. The council do work very closely and put in place a programme of measures to work, a tailored approach of measures to work with that care home provider to try and get their standards back up as rapidly as possible. And now, 3 months into this, I've seen that happen in a couple of instances, and actually seen those care rates go up. So that's been fantastic. And sadly, as well, when ultimately care homes fail, I mean, as we indicated, we're working with 400 care homes across the county. The council swoop in and they do provide that provision, and we do ensure. Now, that's not to say, of course, that's not very difficult for the residents involved. It must be horrendous. But ultimately, that level of care is there. We are able to robustly provide it, and we're able to ensure that the residents are looked after and moved on and they transition into other homes. That said, that's not to also escape the fact that, you know, we're going into uncharted territories here. We might see an escalation, but to this point, I'd like to assure you that I have been reassured that the council's measures are actually excellent and fantastic in bridging those gaps. Melanie, I don't know if you'd like to.
So I'm going to come back to Councillor Kerry's second question because it will help me get into a very detailed level, Councillor Henshaw, about your bit about why people are not in the optimal package of support. So in terms of the adult social care market, we don't have the adult social care market that I would design today. So what we have is a market that's evolved over 50 years to where we are, and that the district and borough councils have huge influence over. So in terms of me influencing the right sorts of development, so ideally what I would want is that older adults are supported in their own home. If they're not able to cope there, they'd go into extra care accommodation, which is still their own home with additional support. That is in the gift mainly of district and borough council. So my role is about influencing 7 local place plans. So you can therefore see that that's quite challenging for Cash and I to be able to do that, to build that relationship with all of our district and borough colleagues. They also have got different planning requirements, and they've got limited ability to control who wants to start running a care home. So we've got oversupply of residential care in Nottinghamshire, and it's not even. So we have some areas such as Newark where we particularly have challenges around nursing care. We have places like South Notts and Rushcliffe where we have very little affordable care, and then in the north we have oversupply because capital is cheap of residential care. So we don't have this balance, and ultimately we'd want more home care than we currently have, but because of some of the the provision, it shifts the market. So hopefully Councillor Kerry, that answers some of your question. As a consequence, we therefore have people waiting in the wrong setting of care. The measure for that is my waiting list. So what we have in the department with our internal dashboard is oversight of somebody who's waiting either as a working age adult. So if I had a mental health issue, I may be waiting for general needs housing. So I might be independent, able to move into my own home. There isn't a general needs housing available in my local area for my district council. So therefore I'm waiting in supported accommodation. I'm therefore taking up somebody else's space in supported accommodation who's waiting in residential care to move in there. So we're waiting on that, chain of events happening. And similarly for an older adult, I may be in a discharge service waiting for package of care at home. I'm therefore then stopping somebody who's in a hospital, moving into my spot because my care isn't available. That's kind of how the system flows and works alongside this market shaping activity. The measures for that, like I say, are in our waiting times. We do also have market measures. And as I mentioned earlier, one of the key measures for us is about our sustainability that we measure, but equally it's about outcomes of people. That's what we're really concerned about here, is somebody able to live a good life in their own home and enjoy the maximum opportunity available to them. That's what the market shaping piece is all about. Hopefully I've answered Councillor Henshaw the questions.
It's a very comprehensive report, Cash, and huge challenges of an ageing population out there, increasing with their multi-morbidities and dementia. And that's not going to end anytime soon. It's only going to get worse and worse. The care homes that are out there and surviving, they're like hotels. I mean, when I started, you had 4 people in one room in a nursing home and a care home, 6 people, all in one big room like a ward. And now I go into the care homes and they've got cinemas and they've got wine for dinner and they've got en suites. So the ones that are out there, there's some remarkable care. And I think, yeah, I want to be in that care home when I get older. But hopefully not for a few years yet. When I'm looking at this, and the area that intrigues me most is the number of people who are awaiting discharge from hospital. And you look at it here and you look at the 300s and the 400s. And for me, I've got a person in a hospital who wants to get home for a variety of reasons. Many of them are inbuilt within the system of the hospital with regards to how they discharge people, etc. So again, if you look at that, you say it costs £250 or £500 per night to keep 400 people in hospital, and that works out at, I don't know, 200,000 or whatever. And you say to yourself, well, that's money that the hospital is spending with that person in there. If you look out in the community and you say, hey, hang on a minute, we can provide that care in the community for a fraction of that cost, at least 50% less, maybe even 30 or 40% less. And that is money that if we had that money, we could provide that care. So it seems to me we have a big pot of money being spent in the hospital here for people who don't need to be in it. We've got some capacity here and the ability to do it if we had that pot of money. There must be a way of flowing the money through the integrated care system, through the ICBs, from the hospital funds into the community in order to get those people from a very expensive place, which is what Councillor Henshaw was talking about, into a much more suitable place for them to be. A huge amount of money being wasted here. Give us that money in the community and we'll look after those people. How do we get that money to flow out? And is that something that's sort of being worked on at the moment? Thank you, Councillor Doddy. It's a really good question. It's quite a complex area in terms of hospital discharge. I think the first thing I would say in relation to the number of people waiting, there's a number of factors that people will be waiting in hospital. So one of them will be social care, but the actual numbers for social care are much lower. But also what we also have is people waiting in hospital for other reasons. And usually it's usually internal transfers between NHS to NHS. It's other complexity around transport, around medication. So the delays in hospital is quite a complicated picture in terms of what's causing that. And then, but having said that, I think what we've recently have is working with our health partners. We're looking at that whole process, that whole journey, end to end, around hospital discharge. Where can we be more joined up, more integrated, so we can reduce those numbers in relation to the number of people discharged. And so that's one key aspect. I think in terms of the point about how can we flow money, how can we get some further resources, because the impact and the cost tend to be significant within health. I think that's an ongoing conversation. It's an ongoing conversation that we continue to try, Melanie and I and the council, we continue to engage, try to influence, because I think that is one strategy, is to really understand what are the true costs to health, and how can we develop an investor safe business case in order to secure further investment in community-based services, in social care, that will enable flow and will enable to reduce our discharges, people that are waiting in hospital. So that's an ongoing conversation, and also we continue to engage through our colleagues within health to do some of that work. It's early days, but that's very much a priority area. Just ask if anyone else wants to.
Switch off.
Yeah, John, I completely concur with every word of what you said. And I think actually, if you take a strategic overview of all the ways that we could help and shape and improve, both in terms of people's standard of life and quality of life, and also in direct cost to not just Notts County Council, but also to the public purse, getting people out of hospital as quickly as possible is the best possible way to achieve that. And there's all sorts of reasons why it's been done well in the past, and it appears to me there's all sorts of reasons as well why it's not working and where it hasn't worked. So my focus is very much on trying to get to the bottom of those places where there's friction and where there's constipation, for want of a better word, in the system, to get those beds, get people out of the beds so that they can get to where they need to be, getting the best service standards of care and recovering as quickly as possible. So in terms of what I can bring to that, despite what's already going on, and there's a huge amount going on, and I don't want to try and muscle in and take any glory for what is already being undertaken, but I think there's a political element to that. And I think political goodwill, there's a lot of empires, egos, and institutions and historical things which may have built up. And I think that there's a political role for us all to play in making sure that politics doesn't get in the way of what needs to be done for our residents. So I'm very, very keen to build really strong relationships. I think we've got a fantastic opportunity at NUH at the moment with the new appointment of the chief executive, who clearly has a great relationship as well with Notts County Council. And I'm very much hoping that relationship and his support directly from Anthony will percolate down and enable us to perhaps unblock some of the barriers that there have been in the past. I think as well as that, there's a significant opportunity with the formation of the ICBs. Again, you can look at that cynically and say we've been here before, we've created CCGs, we've reinvented the wheel so many times, but I'm an optimist. And I had a meeting this week with Kathy McLean, others were involved. So she's the chair of the new ICB board. And we are, she basically said exactly what you said. How do we work together to bring down these barriers? So I think there's a great consensus, there's a great report, a willingness to do something. And I want to do all that I can at Notts County Council to make sure that we work with everybody, we bring everybody to the tent, and we get the quickest and the most rapid transition that we possibly can to get people out of hospital in the care environments that they need to be in for their recovery, and also for the taxpayers' best return on their investment in the purse. So thank you.
Before I move on to Councillor Pringle, who's indicated he wants to, I have a quick question about the impact of COVID on retention in hospital, because I've had some personal experience over the last few weeks. My mother, not in this part of the country, but my mother was in hospital for a broken pelvis, and they managed to give her COVID while she was in there. So that delayed her release from hospital by 10 days, because it happened right at the end of her rehabilitation bit in the hospital. They then moved her on to a rehabilitation hospital, and lo and behold, they got COVID there as well. So that was another 10 days added on to the rehabilitation. And now she's gone into a nursing home, and the nursing home has got COVID, has just got over COVID in one part of the nursing home, and now it's in another part, so we can't even go and visit anymore for another 10 days. So I just wondered what impact we've had in Nottinghamshire because of those sorts of issues, and how can we try and improve the situation.
I can make a brief comment to that, and Councillor, I'm very sorry to hear the experience that your mother has had, and that will be shared by others too. And clearly, that's a concern to us all. I think your comments underline a couple of things. First of all, that as we can see, COVID infection continues to circulate in the community. It's not kept in the hospital to pass on to other people, nor in care homes to pass on. By and large, it's brought into those settings from those of us out in the community who go in. And I do know that in the hospitals, and I'm sure in our care homes, they continue to work very hard to protect our residents against that. We continue to work with our colleagues in the UK Health Security Agency, and also colleagues in adult social care, to make sure that arrangements in care homes in particular are good and strong. Some of those arrangements are mandated nationally. For example, a pause was put on the testing of asymptomatic staff. And as we go into winter, and we probably will, as we see COVID infections increase, I would expect there to be a review of that. That would be an additional control measure which might help to manage the situation. I think it's probably all from me, unless you have anything else in mind.
Thank you, Chairman. Thank you, Cash, Melanie, Matt, John, Gemma, everybody that's responded this morning. I all appreciate it. I've got a couple of questions that I actually printed out because I didn't want to forget anything. So first and foremost is that was a recognition of a black hole within ourselves as to the demand that we're facing. And then again today, and I know you might not be able to comment on that, but we hear a £3.7 million failure from government or nationally within the care system. Now, I appreciate, Matt, what you're saying about the response and that we're safe and that we've got everything in place. But that impact has got to come from somewhere, and it will be a financial impact that we'll have to address at a very certain time. If we don't address it, and we haven't got something over and above what you're suggesting, Matt, is the contemplation of somebody failing this, then we're going to see more people die, and we'll be responsible for that. And that nobody in this room, I will guarantee nobody in this room wants that. But that's where I'm seeing this being faced now today. So at some point, I'd like some sort of recognition from Melanie or Matt or whoever it is to the increase in the pressures, the £3.7 billion pressures, which have been mentioned today. I think that's really important for us to understand. And I get that. You won't be able to do that today. Going back to the report, page 9, paragraph 5, I'm not sure who the independent organisation is. I don't know what the reference is, and apologies if I missed this, but it'll be really interesting to know what their terms are and what they're likely to offer us as deliverables from their reports. That would be something that I think we could scrutinise and something that we could follow up over a period of time to see if we are delivering it. I've got to say, retention of staff has to be primary. This is not new, though. This is not anything new. This is something that we've had prior to COVID. This is an ongoing thing that we've tended to, for whatever reason, see an abuse of payments made for people that actually care for people, because it seems to be an industry which is recognised as a not high class, certainly not a banking industry, which I think personally I would like to see that flipped on its head, and the care industry flipped and replaced, and the bankers receive the funding that our care workers receive. That's obviously not going to happen. But I do think that Gemma's mentioned about the Retford and the Mansfield smashing it out. I've been so involved in the past at an event organisation. It'd have been lovely to have a little bit of detail from Retford today, just to see how many people actually turned up or whatever. I know we're going to get that anyway, Gemma, in the future. But not only that, it's how many people would actually respond positively to it. And I think when we see figures in around 7,000 people leaving the industry annually, that's huge. We have got to recognise that there is. If that was my business, yeah, that is a failure. Okay. And yet we put something out there for the right reasons, and we should all applaud the efforts that you're doing. We get a response of 1,600. How many of those 1,600 responses actually turned into anything positive? Because I don't know. I know we've got 1,600 responses. That's a third or 20% of the people that's leaving the industry. So I'm really concerned about the impact on the debt as it is at the minute, Matt, yeah, and the ongoing 3.7 billion not noted today. Huge issue for me, that, because we are facing, if we have a bad winter, John, you know, a bad winter will impact on anything that we want to put in place to protect people. So we'll have to be responsive as well there as well. So the fear of the unfortunate deaths that aren't recognised because of the financial thing is a real difficult one for me to put up with, to be honest. But certainly, I'd like to see some of the responses from the 1,600 into what positive, how many people actually ask for a job out of them 1,600? Are we able to do that? And if we're not, perhaps the next thing we do, we might be able to put a link in to anything that we advertise so that we can follow it through and get some more information. Thank you, Chairman. Sorry, I'll come back. I do apologise. I'm sorry, Matt. And the involvement of I know unions aren't in favour of the ones at the minute, but what involvement have the unions had? Because at the minute, the unions that I'm talking to are open to any suggestion that offers protection and service provisions. Thank you.
Thank you, Chairman. Thank you, Mike. So I don't know whether you're getting to know me yet or not, but genuinely, as far as I possibly can, and while I'm in this role, I want to take politics out of this conversation, because I don't think it's helpful. I think that I completely agree. You asked for acknowledgement. I think that I've repeatedly agreed that the challenges that we face are immense, they're significant. That's of course not to say that we're not spending more than has ever been spent at any point in history on what we're trying to achieve, and that there's not more effort going in than before. The backdrop is difficult. the inflationary effects are horrendous. The ability to recruit and retain staff is extremely difficult. And of course, the net result of all of that is a perfect storm for difficulties and challenges in our care sector. So I genuinely believe there's no hiding away from that. And I've actually been very grateful, and it's been very helpful to me with trying to take the politics out of the agenda to have the support of Ben Bradley, who has allowed us to be very honest in these matters. We've not tried to hide at all the reality of trying to implement the government's well-intentioned suite of and programme of improvements for the care sector, but in actually putting hands up and saying what this means in terms of trying to deliver those things at this time on the ground in a real living, breathing county council. And I had a fascinating moment this week. It's always, you wonder why on earth you ever get elected. I was saying this to Jonathan before. You can't believe the things that happen. I had a very strange encounter at the Conservative Party conference, which I only attended because I had some personal invitations because of this role. That's the only reason I actually went to it. And I found went to some things focused on adult social care. But on Sunday evening, I found myself at a forum. It was actually a non-political forum. It was chaired by the head of crisis. The panel was there looking at how we can sustain some of the things we learned through COVID in terms of getting everybody in, getting everybody off the streets. Homelessness is a particular passion of mine. It goes back many years. And so wherever possible, I'm trying to direct funding, even in this difficult time to homelessness. So that's why I was there. Anyway, it was a fascinating conversation. Bob Blackman was also involved, who's had a very long-standing interest in homelessness issues. And I said a few words at one point and introduced myself as the cabinet member for adult social care in Nottinghamshire. There was a slight change in the tone in the meeting from that point, and I couldn't work out why. And at the end, there was a little group of people who'd crowded around me, who basically were there. It felt a little bit like hero worship, which I know sounds revolting. Who were so overjoyed that because my name's been put on it, which isn't really fair. It's come through the officers and through Ben, that we've been so honest about the challenges we're facing politically and what they mean and how we're going to work through those challenges to get what we need out of central government to get the resources targeted where they need to be. That people were delighted. And so Nottinghamshire County Council, because of the work Melanie has done and because of Ben's voice in this, have opened the door for other councils and administrations across the country. So we're all in this together. I want to take the politics out of it. You're absolutely right. It's really, really difficult. But we're making those arguments as loudly and as clearly as we can in a non-political way to our own administration in the Conservative Party. So we've got Robert Jenrick on our doorstep now, who's just been appointed back into the health arena as a minister. So I'm hoping that he's going to be listening. I'm doing my best to get in contact with him and get him to have an early meeting with about our significant challenges here in Nottinghamshire. And as well as that, we're already in contact, certainly Melanie is, with Neil O'Brien. So we're doing what we can. We will continue to do that, but we're not going to tell lies. We're going to tell the truth. We're not going to be ostriches. We're not going to be magpies, and we're going to tell the absolute truth because it's people's lives that matter here, not politics. So I hope you take that as genuine. It is always going to continue to be my answer, even to the point that it might get me kicked out of my own party. But I'm going to be honest about these things. So I hope that's helpful. In terms of jobs, I'm going to let others comment, but I was delighted that that this jobs fair there's already one taking place. There's one taking place as we speak. And again, it's easy to be cynical. I'm interested to see how many people attend. I hope it's well attended. But again, I've done what I can to advocate for that because the careers in this sector, the pay is where the pay level's at. We're doing what we can to get it up. We already have done this summer. But it's a great career to work in. And, being involved in social care, being involved in people's lives, making a difference every day to the daily life of those in our own society, it has a social value to it, which you just cannot underestimate. And so I think we need to change the narrative. And I'm really eager to do what I can to support that. I've already been trying to do that a little bit, trying to encourage people to get along to this jobs fair, because there's a great value for any young person's life in working hands-on, front line, much more than just a quality of life aspects. Actually, what it brings to society is just fantastic. And as well as that, working in adult social care, there's great tailored opportunities that we can bring. It's not just a 9-to-5 job. What we're talking about doing is offering people hours that suit their life. So people working around their own arrangements, their own family lives, their own childcare situations. We can offer really tailored work environments and packages to people looking for extra income and also wanting to bring social value in their lives and a sense of great worth. So there's great opportunities here, and I'm going to be optimistic, I'm afraid, as always, and I hope it's a great success. But like you, I'd also like to see actually what the result of that is, what falls out of these endeavours. We'll try anything to get more people working in adult social care because we need more hands on deck.
Thank you, Councillor Barney. Councillor Pringle, you wanted to come back.
Just a small point, Matt, please. I don't want to ever say this to me again, that I'm politicising adult social care, because I'm not. I don't want to keep mentioning about the politics of it. Everything that I commented on is in the report that Cash provided, not that I've provided. So I'm asking for detail on the report and a response on the report only. Thank you.
Councillor Barney, you wanted to respond?
Yeah, I'm really sorry if it came across in that way. I was actually reflecting the mirror on myself, saying that I didn't want to be political. I was not reflecting that you, and I really, actually, if I achieved the opposite in that statement, then I apologise, because that isn't what I was trying to do. I genuinely want to get politics out of it, not, you know, we're getting political, so let's stop. But anyway, I'm sorry if it was taken in that way. I didn't mean it to be.
Councillor Carr.
I say, Councillor Barney, you're a very decent chap. I accept that. I've always got on with you. But if you think you're going to take politics out of what is probably one of the most political things in the country, i.e. health and social care, then I think you're going to be disappointed. But having said that, it comes on all of us to actually work together to ensure that what our officers are doing is supported. And from what I can see so far, it's a good start. But they're hampered by the elephant in the room, or actually at the moment it's probably a herd of elephants in the room with regards to health and social care. I mean, let's talk about the finances for a start. Soaring inflation and rising costs will mean Nottinghamshire County Council needs to find an extra £24 million to balance its books next year, not TV. In response to that, over 3 years, we will need to find £59 million, and next year it's £24 million. It will come through a combination of savings and council tax. Councillor Richard Jackson, who's in charge of our coffers. That's one elephant in the room. The next elephant in the room is the fact that, and again, I can be unpolitical here because every party, every government of every colour, including my own, have failed when it comes to sorting out the adult social care market, and particularly the care homes, and the fact that people have to still, even whether it's changed a bit, still have to sell their properties to fund social care. It just hasn't happened. We have fudge after fudge, promise after promise, which doesn't materialise. The ICBs came on the back of the healthcare report that Rishi Sunak kept brought in. And we all thought, I know, Melanie, you did, because I saw it in the paper that you said that this was a good start. And it was a good start. But that was being funded by a 2% increase in national insurance. That has now gone. So we've had these ICBs have been put in. It remains to be seen whether they'll do a good job, because quite frankly, the CCGs didn't. So, you know, give it a different name, but it's the same thing. Is it going to work? I really, really do despair at what's happened. You say you were at the Concerted Conference. Did you manage to hear your new leader's speech at all, Councillor Barney? No.
Councillor Carr, with respect, I don't think what went off at the Conservative Party conference and the Prime Minister's speech is relevant to our meeting today. We're here to scrutinise
the fact that out of a whole speech she mentioned adult social care and health in one sentence. That isn't important. Well, I think it is. I think that's another elephant in the room. Well, leading to the report that we've got here, paragraph 54 of the actual yellow papers actually says, if I can find it, the level of risk in the current care market is unprecedented. And without intervention on the part of the council, it is likely that will be rapid escalating level of provider failure. All I would say there is that most of the, well, all of these organisations are private companies. There's very, very little public aftercare now. To grow the market, you've got to actually get people to invest in it. And at the moment, the risks compared to the return of capital are far, far too high. Far, far too high. So we can forget that for the time being in the current economic climate. Paragraph 55 says the current lack of capacity is already creating a system-wide pressures and resulting in people not receiving the most appropriate service, which is leading to poorer outcomes for residents. It is also impacting on the quality of some of the provision being offered. A question there, can you tell us, to your knowledge, how many people are currently not receiving the most appropriate care?
Councillor Carr, I think that question has already been answered earlier on in the meeting. I think all members will agree, and I don't see the point in going over again what we've already answered. If you were asleep or not listening, then that's another matter. But perhaps, Councillor Carr, if you ask questions rather than making statements, then we might make more progress. But that question you've just asked has been answered quite thoroughly by the top table, and I don't propose to ask them to go through it all again.
So thank you, Councillor Carr. You know, I genuinely appreciate, you know, there has to be the political element in bringing in and challenging is that's so important. We, you know, what we're doing really matters. It absolutely matters. And so I'm grateful for your questioning, and you're welcome to carry on as far as I'm concerned. The 24 million, of course, it's terribly serious. We're all aware of that. Everybody's on the same page. We want to do all we can to make sure that we can plug that gap, and that is what we're trying to do. I would say that I'm grateful for the fact that this portfolio that I've landed in is challenging as it is, isn't as challenging as it is in other local authorities. But as soon as I say that, it sounds like I'm gloating. I'm not. I'm glad that it's better for me in this position and what I'm trying to achieve for the residents of Nottinghamshire. But regarding the conference, I don't want to talk, and I'm sorry that it's obviously provoked even mentioning that I was out there, and I'm sorry that politics is so contentious that it gets people's hackles up in that way. But I did attend another session that was actually chaired by the chairman of the LGA that was looking at new costing funding models on how, I mean, it was blue sky thinking, again, be cynical, but you're absolutely right. We need to find better funding models. We need to find better methodologies for how are we going to get more care homes open? How are we going to have more state of the art? Who was it, John Doddy said about the hotels? We want the best quality of care. So I'm not going to give up trying to find better ways forward. I've not got all the answers. I'm not the Prime Minister of this country. I'm not seeking to be. I'm sat in I'm sat in this role for as long as I'm in it. I could be decapitated at any time, but when I'm here, I am. I don't care what anybody else says and how political anybody else wants to make it. For me, we've got the levers of what we've got. We've inherited what we've got, and I'm going to do my best job with the support, I hope, of everybody in this group who I know is only interested in trying to derive the best results and outcome for Nottinghamshire. So I'm sorry if it sounds trite. I'm not meaning it to be. I'm genuine when I'm saying that. I hope my officers would also confirm that I'm open to talking to anybody. Let's get the job done.
Thank you, Councillor Barney. Councillor Creamer.
Thank you, Chair. Just going back to the finances again, the page 18, paragraph 11, whilst council provides some in-house services such as reablement and day services, most are commissioned except from external sources for 300 million. How is that 300 million broken down? Can this 300 million be clarified into where it comes from, grants, etc., hours, and particularly how much we actually pay towards it? Or leave these costs. How is it paid for with a mixture of public and private funding? And do we have a percentage breakdown at all? And within that, going back to the presentation just a little bit, part of the presentation, which I may have got it wrong, said there were examples of other councils and other ways of doing things. I mean, do we have any examples of other councils doing things differently and how they're actually paying for stuff and how it's working? And would this possibly address an earlier question that has been brought up about the 30% turnover in staff? So it's sort of a triple. It goes around the finance, but it actually does ask a question as well. How much help can we actually give to improve? Because the very basics of the service, we need staff working in it. I mean, Councillor Barney highlights says it's a service and it's a good service, but unfortunately we've got 30% turnover, which is not good in any industry, let alone this one, which is struggling at the moment and likely to struggle, particularly at the moment with winter coming on. So a bit of a rant there, but not political.
Thank you, Councillor Creamer.
So in terms of our care commitment budget, so the money that we spend supporting people, that's around 300 million. So about half of that is on adults under the age of 65. So that'll be adults with a disability, physical disability, learning disability, autism, cognitive needs, someone with an acquired brain injury, someone with a mental health issue. The other half will be people that are older, so needing extra support due to their age and their age-related conditions. So it's about 50-50. So about half of that spent on older adults, half on working age adults. And out of that, that will be right across how they receive the support. So there's a number of people that we support within supported accommodation, particularly working age adults. There are some that we support in extra care. There are some that we support in care homes, and there are some that we support in their own home. And then again, there's some that we support 24/7, so they'll have a package of care that enables them to go to a day service, that'll enable them to seek work, that will have a personal assistant supporting them with their activities of daily living, or maybe in a care home. And there are others that maybe receive smaller packages of care that just enable them to be getting out to work or travel, having some care in the morning. So a huge range of different percentages. Obviously, what I don't have in front of me is the budget report, but we do report on that regularly, and so that is visible in terms of where that money breaks down to answer that specific question. I'm sorry, Councillor Creamer, there was a second bit to your question as well. One was about the money.
It was about the money. One was about, which is the presentation, going right back to the presentation, where it mentioned there was examples of other ways of working, and I just wondered if that tied in with the expense, etc., and do we have examples of the other ways?
We do, thank you. That jogged my memory, because we also didn't answer very clearly Councillor Pringle's question about the independent organisation. So as I'm sure you all know, as well as working within Nottinghamshire, we also work regionally. So as East Midlands ADAS, we work with all of the other 7 local authorities across East Midlands. So we've been working very specifically on this area. So there's 2 things we've been doing. One is undertaking the cost of care work as a collection. So we're doing that for Nottinghamshire, but comparing that to the other local authorities. So we've got clear visibility of how the cost of care, which is a hugely technical financial piece of analysis to understand, is how people are running their businesses and where the money is going in a business. We call it the cost of care, but that is kind of a heading for a very complicated analytical piece of work. We've been undertaking that in collaboration with the other local authorities. And equally, we have a commissioning collaborative, which is having a look at how we're jointly building home care capacity. So as Cash mentioned, we're learning from the best practice from other areas in terms of the care association and how that becomes truly provider-led. So where that the market is leading that rather than us as commissioners. We're taking in some of our work. So many of you may have heard of the work we've undertaken with one of our providers on early deterioration, where we've been partnering the NHS and a digital provider to be looking at how we can be interacting differently in someone's care. So we've taken that learning into that piece. We've also did a pilot project on home care capacity in Nottinghamshire that others are learning from, and equally each of the councils had their own piece of learning. So that's the way that we're learning from that best practice as a region, because that's really important, that regional piece of work. So hopefully, Councillor Pringle, that also answers your question about how we're doing that as a collaborative and why we've been supported by an independent organisation.
Yeah, thank you, Chair. A lot of my questions have been answered. Thank you. I do have grave concerns, though, about the impact of inflation and the energy costs on the care providers. And, of course, the other side is the labour market, the workforce and their ability to attract people into that business. And I hope I've never been to any of the fairs, the careers fairs, but are they broadened out a full scope of adult health and social care? Are we trying to attract occupational therapists and social workers and all such like, because they have a great impact on discharge to assess and how people live at home longer in a better environment. So that would be one of my questions about the work fairs. And I know, Gemma, you have a lot of good relationship with the care home providers. How are you feeling there? Are they in fear and trepidation of this winter because of the cost implications? Because I know we've given a large amount of money to help increase the pay, and I'm wondering if that's all being passed on and if that's enough, because their sustainability is our Achilles heel, I believe, and I think it could have a greater impact if more of those fall by the wayside over the winter because of the financial climate at the moment. What will we do to mitigate that should some of those fall off the rail?
Thanks, Councillor Martin. In terms of the fairs that I've referenced today into the Mansfield and the Retford, those were solely for external social care, so care homes, home care, for our external providers to showcase their sort of come work for social care. And obviously, what I didn't mention earlier on was that when we did the recruitment advertising campaign at the beginning of this year, we did a suite of videos that were with our providers to try and entice people to come and work in social care, so actual real life care homes, supported living. So we use those videos in terms of trying to bring more people to work in social care. But yeah, so in terms of the fairs that we've got today and the previous they were for the external market. But we do, as from our internal provision, our occupational therapists, our internal services, any job fairs that are out there, we go along and join those. So there was one recently, I think it was last week in Mansfield, that the district councils run. That actually our internal teams were part of that, and obviously our external providers could have accessed that as well. But that was for, it obviously included all organisations. So yeah, so that's in terms of those job fairs, and that's something we are linking with our local district councils in terms of, obviously there was one last week and we've had ours this week. Actually, would it make sense actually going forward to learn from both and do it as more as a collective and organise it so we don't have too many at the same time? But we weren't aware they were happening, so there's still ongoing learning and relationship building. But also we're linking in with our DWP partners. So we've linked in with those in each of our districts and tried to build those relationships and their work coaches, because actually social care for them was obviously not high on their agenda, even though they know that there's a need. They've got a lot of things they're working through. So my external workforce lead is working with the DWP in terms of that social care agenda as well. So there's a lot of things we're doing as well as the job fairs. So we've got a lot of priorities to work through. In terms of care homes, care homes, home care, they're all experiencing increased costs, and we do quite often. We've got an open door. We've got a good relationship with our care home providers and all of our providers, and they do contact us quite regularly with the worries around sustainability workforce fund that obviously Cash mentioned in the presentation. So we do talk to them, and we are working with them in tries of ways of looking at how they can get through the winter. And obviously it's all about them actually best use their business, filling the beds. So yeah, it's an ongoing conversation. Melanie talked about obviously we have got a lot of care homes in Nottinghamshire, and there is some vacant beds. So it is that ongoing conversation, and that conversation's not changed. Obviously we have times where we've got homes with vacant beds, so we've always continued those kind of conversations, but the cost of living is that added additional worry for the winter, so we just got to work with them through that. Thank you.
Only on the disproportionate care provision across the county, how do we balance that then? How do we move people around from one area to another? And because it's a difficult thing, and I feel your pain with the extra care, because that is a really good service, and that ought to be, that's something we really ought to be focusing on, because that's a much more cost-effective way of providing care in the right place at the right time.
It's a really good question. I think there's not a quick fix I think what will this require a concerted effort and strategic approach with our partners, with districts. But equally, I think there's so the programme will work, when I've referred to market shaping, is about ensuring that the market understands what the needs of our residents are and what types of services we want to purchase on behalf of our residents. So much more alternatives, community-based services. We want more of those supported living, supported accommodation types of services going forward. More people supported in their own home, and use of technology. I think so. In order to do that, I think making sure that we get those messages out. We have those provider forums, and through those provider forums, we have those two-way conversations about ensuring that happens. But then equally, it's about influencing district around planning, around ensuring that actually we don't get that oversize. At the moment, we've got an imbalance where we've got more residential, but where the gaps are is around nursing, around more home care. And what we are having is active conversation with providers about how they can adapt, how can they change their business model to another type of model which actually will be more sustainable going forward, because that's where the need is. And that shift, and that will be an ongoing programme of work through our market shaping team to ensure that we do that, but also it will require about how we can influence our partners to ensure that they can support us in that journey.
Yeah, Cash, thanks for that. I think there was a working group in the last administration from 2017 to 2019. Subati was on that, so we did a lot of work to sort the demographics of that out across the county, and we discovered that the Clifton Clifton home was the best one, because it's very Clifton Holiday Village, I think it's called, something like that. It's very diverse. It's got everything in it, you know. That's the one you need to look at.
Councillor Owen.
Yes, thank you, Chairman. I just wanted to explore a little more closely the issue of rotational recruitment. You talked about how you've implemented things that you hope are going to stabilise the market. But the issue of recruitment is, I think, a difficult one. You've talked about attending job fairs. And whilst I wish you every success in that, I suspect the translation into actual people who start work in the system is going to be very, very low. Is there any work done in schools to highlight the opportunities in social care? Because it seems to me that there are opportunities there to try and get in at a very early age to sell the whole career of working in social care. And those are opportunities that, if we could, we perhaps ought to be taking, because if you can get it fixed into people's minds, into children's minds, there are opportunities here. It is a worthwhile career. It is something that they would like to do other than become bankers, as Councillor Pringle has suggested. Then I think you may find a much greater success. So I'm just really wondering if any thought has been given to that, and if any work is done, or is it something that could be considered?
I completely agree, Councillor Owen. So I mentioned that we have 24,000 care workers at the moment. We think we've got around 30% turnover. So you can imagine just that volume of people leaving and starting is just immense. And so all of the efforts that Gemma's described are needed. In terms of accessing schools, we are starting to work more closely with Further Education College and trying to work on that whole pathway. I think the bit that we don't do successfully locally, or indeed nationally, is sell care as a career. So, for example, I started as a care worker when I was 17, and I obtained all of my degrees by working part-time. But that kind of ability to sell the fact that you can be a care worker and can end up as a director of adult social care, I don't think it's well made nationally and locally. And the fact that it is a career, it's a career of value. And even if it wasn't about your aspiration to be a director, you can still aspire to be a commissioner of services, become qualified as an occupational therapist, a social worker. That pathway, I don't think, is sold in the right way, as we don't deal with care yet as a career. In fact, some of our own images, whilst they're very lovely, look, a partnership between a person and a care worker, it doesn't give that message that this is something you do beyond that, personal relationships. I think there's much more we can do in terms of marketing it as a profession. I'd agree with you.
Thank you. That's something that the NHS have been piloting in Basilo with a couple of the schools that are in my trust. So it's probably something that we may want to take lessons home from what's happening in the health sector on trying to encourage people to go into healthcare. And obviously social care and healthcare mesh together very well. So if you want me to put you in touch with one or two people, I can do. Councillor Henshaw.
Yeah, it's been interesting to listen to the debate in relation to the report from Cabinet that we are supposed to be scrutinising. In relation to my earlier comments, I think a little more time needs to, or a little more water needs to flow under the bridge before we can make a more supportive or critical analysis of what the committee is doing under Matt. Some specific points in relation to the report, and it's been touched on with some of the questions. I mean, obviously in the report, it indicates that there are concerns and challenges, particularly with recruitment, which I hope the things that the committee implemented in relation to the pound uplift, which I think our group suggested right early on in the financial year, and thankfully, it was taken on, and that's not being political, it's a statement of fact. So the work is ongoing in relation to recruitment and retention. Let's hope these jobs fairs and the contacts you're getting with further education may lead people to want to go into social care as a career. But I mean, it's still one of the big stumbling blocks. A lot of people that come in under 18, some providers still only pay the minimum wage at that age. It's £5 odd an hour, I think it is. Which in itself's a problem. I mean, we've got to get a commitment from providers to actually value the staff and give them an appropriate rate of pay. Plus, they need a more structured pathway to training and career development, which is something I think social care is not good at, and I think it's something that we should be pushing providers to sort of implement. In relation to the report, the point on the future, the fair cost of care, which would, if it's implemented next October 2023, and it's been highlighted in the report that we were going to end up with a big sort of deficit, a 32.75 million deficit. Now, I've heard this morning on Radio 4 coming in that the County Council network is actually suggesting to government that they don't implement it in October next year and they push it sort of in the long grass further down. But I think even by doing that, it will still create a problem, because if the government actually changes the way that social care is funded from that aspect, they can't just say, well, we're going to give people another £85,000 out of the capital and then don't give us any extra money as a local authority to sort of compensate for that. So I think that's an area where, through you, Chair, we can work together and put something to council and do something together. If we all want to work together, there must be things in this report that you as chair and us as scrutiny members could actually push forward together and try and put things to the government to try and sort of address the problems. So there's a lot of good in this report, and I think we need to further down the line come back, reassess it and look at it again. In the meantime, let's work together and push things forward to government, and hopefully with your contact we'll see a little bit of growth in this sector instead of the problems that we've got. But I wanted to ask a specific problem because it's highlighted in the report in relation to supported living services. Now, supported living services obviously are differently funded from registered services. Is there a benefit through you, Chair, for Nottinghamshire County Council to push for more supported living services? Because obviously, if there is a benefit to us to do that and a benefit for the people to go along that route, then I think we ought to look at it and see. I mean, at the moment, we've got a mixed sort of package of care, haven't we? We've got, caring the community, individuals and the homes. We've got supported living services. We've got registered care. So, there is a mix. But at one time, there was a big push to go into supported living services. So I just wondered if committees actually and the cabinet have actually discussed that, because I think that's an important sort of area we could move into. And the other issue, sorry for going on, Chair, but the money that we actually give to providers, the rates that we set, talking to providers, and you may say, well, they may say this, they don't feel that us as a county council give them sufficient monies for the services that they provide, and they will always be pushing and asking for more because all their costs are increasing. So I mean, that's another issue. I think the rates of pay or the rates that we give to providers, I mean, I'm not sure how it is in relation to other councils, but if it is a problem, I think the cabinet ought to address that and look at it. Anyway, with that, thanks, Chair.
Thank you, Councillor Henshaw. I think if you look at the work programme, we are revisiting this, and it is actually in the work programme. And I think the issues around the differential between what the council offer and what private individuals pay is going to be addressed by the fair cost of care review anyway. So hopefully those two things will, and I, at the end of the meeting when we summarise what we want to follow up on, I think that those 2 points will come out loud and clear.
Thank you, Councillor Henshaw. In relation to supported living, this is a key strategic priority within adult social care. We have a housing with support strategy that sets our ambition. And although during COVID, a lot of the work did slow down significantly in terms of developments. However, in recent weeks, what we have put forward is a comprehensive programme of work around supported living provision. What we do is we understand the needs. So we know that there's X number of people that require supported living, supported accommodation. And as a result of that information, we then develop tenders, and those tenders are being programmed and planned over the next 12 months. So the market will be able to respond to those and develop those in a timed programmed way. So just for example, that program will work. It's really ambitious. We're looking at over 300 units of supported accommodation over the next 12 to 18 months. And providers and the market are really keen to develop those. And so those tenders are programmed and they have been approved. And so we have a pipeline to develop and shape that going forward. And that's a key priority within the department.
Yeah, thank you. Of course, one of the reasons why people aren't attracted to social care as a career is the abysmal pay. And I think that's one thing in your plan that you've tried to address, and that's commendable. You can earn twice as much working for Amazon warehouses in Broxtowe and Ashfield than you can in a care home, which is a big issue. Given that we've already identified and the report identifies that there's a lot of factors and situations which are beyond our control, and whilst it is an excellent plan and it hopefully will deliver what we're wanting it to deliver, there is a high risk that it may not work. What might Plan B look like?
I think that what we've tried to set out is that we've got plan A, B, C, D and E, and we're enacting all of the plans at the moment. So that's our strategy. It's multifaceted. It's working in partnership with the providers, and it also includes the element that both Councillor Barney and myself have referred to, where we're trying to influence nationally. Because I think you'll be aware that with 24,000 care workers in the county, if we were to look at any significant impact, changes to pay terms and conditions, that have to be funded at a national level, because just simply wouldn't be affordable by the county council. So as well as lobbying and putting forward the views about pay through ADAS and National Department of Health and about a workforce plan, so we do need a national workforce plan to tackle this issue. We're also trying to, as Councillor Barney has said, work through the Integrated Care Board and try to have a partnership approach of the NHS to managing the workforce, because there are issues about how people flow through health and social care. But like I say, it is about trying to just have a multifaceted plan to tackle all these issues at the same time. So there isn't really a plan B. We're just trying to work on all of those different fronts and interfaces.
Thank you. Councillor Adair.
Sorry, I was a bit annoyed with you. You said you left me in the dark for a long time, so I kept you out of. No. Was it the? I'll have to. Anyhow, sorry. On about the negative and the positive side of life. When people are going on about funding and all the rest of it, and all these things, it's all there. We have to manage this now. It's in our ability as a council, and we as this scrutiny team, we've got to look at the positives and where we can go and how we can drive the positives. We won't answer all the questions. There isn't a comprehensive plan that can sum up all the costs and all the rest of it. One thing I will say is that having used the service and other people use the service, I never get a negative response from anybody who's used our service. So the department is doing something right and something correct there. They might be stretched about how they do it and all the rest of it. The third thing is knowing some not pay them on time, the city doesn't. So that stretches their cash problems and makes them weak in supporting us and helping us to do helping to provide the care. In fact, sometimes the city can actually destroy a care business because it's not supporting them in the way that Nottinghamshire is supporting them. So there's lots of factors there when it comes to the care sector out there as a whole. And that's not to say that we don't have to keep monitoring them and improving and all the rest of it. But there are other factors that come into it that actually have negative respects on how we could operate if those negative respects weren't there. So I think what we have to see the way forward and make no apologies for the fact that we have a problem. There's an issue there. And the only way we'll ever sort an issue is to go at it positively and not negatively.
Thank you, Councillor Adair. Anybody want to come back on that, or are we?
Just to say, I appreciate getting the letters that we get that acknowledge the good works that are undertaken, and I'd immediately want to shine those back at our incredible staff. And I'd love to change the basis in which care workers should be up there with the greatest workers in the NHS. The hierarchy needs to be taken away. And we're so appreciative of our incredible staff who every day get out of bed and change people's lives. My goodness me, we're thankful for what they do.
Thank you, Councillor Barney. I've got a couple of quick questions that haven't been covered that I was wanting to delve into. One of them is the market shaping team that we're proposing to set up. Is that going to be additional staff, or is it going to be internal appointments? And how are we going to measure if it is an external additional staffing? How are we going to measure the impact of that additional staff, and what sort of timescale are we going to be looking at to measure that impact? And the other issue is the 500k workforce money. Very little of it has been taken up. Is that because it's not needed, or is it because people don't know that it exists? And I just wondered whether we were signposting it well enough for the providers.
Yes, so in terms of market shaping team, we're in the process of recruitment. It will be a combination of both internal. We expect internal and additional people joining that team. So the recruitment process is between October and November. Gemma and the team are in that process of recruitment. So it's a combination of both in terms of that we expect some internal people that may apply for some of those roles, but we also will ensure that people outside the organisation can also apply for those roles. It is quite a high skill set, so we expected people, to have that kind of experience around working with providers. So that's ongoing, and and then we have got those in through my presentation. We talked about some of the key priorities for the team around market shaping and market development, and again we'll continue to measure the impact of that team going forward. In relation to the 500k and the provider sustainability fund, yes, there has. I agree. I think there's been a relatively low take up. What we have done is we specified quite a clear, specific criteria around where the support would be offered, particularly around fuel, around energy costs, and so on. And so, we have received those applications; those have been processed. There is a bit of a lag as well. So the figure that we've actually included in the report that will have increased and will continue to increase. So providers have the ability to access that. I also suspect there's been a national announcement around support around fuel to businesses. And again, as a result of that, it may mean that actually there may be slightly less pressure on this particular fund, but we will continue to review and monitor and continue to have that engagement with our providers going forward.
Thank you. Anyone else before we sum up? No? Good. We have been making notes furiously as we've been going through. So Martin's going to go through what he and I have picked up as we should be pursuing as we go forward.
Okay, so on behalf of the chair, the recommendations are that firstly that the report be noted. Secondly, that a further report on social care market pressures be brought to the September 2023 meeting of the Select Committee to provide a progress report on the activities being carried out and their impact. That members of the Adult Social Care and Public Health Select Committee receive a briefing in spring 2023 on the impact of the increase in fee rates for commissioned home care and care support enablement services in addressing the current instability in the social care market in Nottinghamshire and in supporting its longer-term sustainability. Fourthly, that the Cabinet Member for Adult Social Care and Public Health, in consultation with officers, considers what activity could be implemented to increase the uptake of the funding that has been made available via the Provider Sustainability Fund. And finally, that as soon as available, an analysis of the impact of the recruitment events that took place in September and October 2022 be circulated to members of the Adult Social Care and Public Health Select Committee.
Are members content, or have we missed anything out? Is there anything that we've missed? We've furiously been writing, but I've got bits of paper here with all sorts of things on, but I think that sums up the main points that came out of the debate today. Unless anybody thinks we've missed anything, now's your opportunity to speak.
You're going to say we've got an awful lot of stuff we want to look at, but have we got enough meetings to look at them?
Some of this will be done outside of the planned meeting. Some of it will be written reports that will come to members without them. We may not need meetings. We will call additional meetings as and when we require them. We're not going to wait for the 4 meetings a year to cover everything. For a show of hands that we approve those recommendations. That's unanimous. Thank you very much. So we move on to the work programme, and Martin's going to take us through that.
Yeah, so I've got the work programme attached to the report. That was the work programme that was created from suggestions from this committee and also from the meeting of the overview committee, and obviously discussions with officers as well. And that was approved at overview last month. It's just note really that we can add extra items on there. So if there is anything else that you would like looking at, so contact myself and the chair, and then we'll take the relevant discussions with officers and the cabinet member, and then ultimately it's up to the chair of the overview committee to agree if we add any extra items on. Also, just finally, the forward plan. The forward plan is published monthly, so just keep your eye on that. If there's any issues that you'd like on the forward plan that you perhaps like to do some pre-decision scrutiny on, and again, contact myself and the chair about those. But the work programme is just there for noting.
Fine. Anything in particular anybody wants to comment on, or additional items? Councillor Carr.
At the original meeting, I did ask that we have a look and make sure that our peripatetic staff, because of the rise in petrol costs in particular, are being fully recompensed for the mileage that they do and are not out of pocket. I'm not necessarily saying that we need to put this on the work programme, but I would welcome a written response to that at some stage.
If you refer to the overview work programme, there was an item there on kind of like a broad. It was raised as like adult care issues, but there's going to be a broader piece of work carried out by overview next year on staff and the support for staff, and that will be covered on there.
Councillor Hench.
Thank you, Chair. In relation, I've raised this issue before at various points in relation to day opportunities. I think it would be useful for some for members to actually visit some of these. And now that COVID's no longer such a major problem, I wonder if we could set some visits up to the day centres.
I'm sure it can be arranged, but don't you believe that COVID is not around? I can tell you 25% of the wards at Rampton Hospital are in isolation. So I'm sure we can consult with officers and arrange it for those that want to have a visit when it's safe and to do so. But as we've done with other departments with children's and young people's and the outward bound stuff that we do, I'm sure it can be arranged. Melanie.
The infection control methods in day services and adult social care has only literally just been stood down, and I'm expecting that to be stood back up with the increase of COVID. So I think just to bear in mind, committee, we are working to that. Adult social care really has not been out of COVID measures yet. Similar to the NHS is just standing back up some of those restrictions. So I think we'll wait to the point at which when we're sure that people are secure.
Can we approve the work programme as laid out in the documents? All in favour? Clearly carried then. Thank you very much. And that concludes the meeting. Thank you for your attendance.